If I'm coming through okay, or if I need to speak louder, somebody just type in the chat box there to let me know. Okay, very good. Welcome to Essential Oils and Medication Interactions. My name is Jason Ivy. I will be giving everybody just a few minutes to get settled in. I think we've got some more people signing in now, so about 2 more minutes, we'll go ahead and get things started. Meantime, everybody just kind of let me know what part of the country you're from or part of the world, either way. Okay, Montana, Colorado. Jersey representing. Welcome. All right, well, we'll go ahead and get started. I just want to thank everybody for taking time out of your day to join us. Today we'll be discussing essential oils and medication interactions. Again, my name is Jason Ivy. A little bit about myself. I am a registered nurse, have worked primarily in emergency medicine for the past 21 years, and have been doing essential oils for about a year now. This is actually our 1 year anniversary in doTERRA. And last year, when we first started the oils, Kim brought them home, and honestly, it was didn't take a lot of stock in it. It was like a lot of people initially that, it's voodoo medicine. Smelled really great, but that was about it. But as we started using them, I began to warm up to them. The kids were, rowdy and fighting with each other, and we'd put some Serenity and lavender out there for them and diffuse it. And next thing you know, all the kids are relaxed and chilled out watching TV, and so began to take a little more interest in it. But the big turning point for me was when I've been on blood pressure medicine for probably about 10 years, and Kim had started me taking LLV. I had been taking it for about a month, and I noticed that when I was working around the house, I was getting dizzy and lightheaded. And to me, that told me that my blood pressure was bottoming out on me. It was getting too low and that there was a problem. So I called up my primary doctor and said, hey, explained what was going on to her. And she said, okay, well, I want you to stop your medication and come see me at the first available appointment. That was 2 weeks down the road. So I stayed off the medication, and 2 weeks later, I get to my appointment and go in and see her. And they first thing they do is check your vital signs, and my blood pressure was 120/70, just perfect. That was even lower than what uh, it normally was with taking medication every day. And so, naturally, she asked me what I was doing different. Was I exercising or, eating different? And I said, no, the only difference is the essential oils and the supplements. She said, well, it's working, so I want you to stop your medication and just keep a close check on it. And so every day I'd go into work for the next few months and just check it, just, waiting on it to go back up, and it stayed normal. That was my turning point. That was my eye opener to the oils. And so at that point, I started researching. I wanted to know how they worked, why they worked, what was making it do the things that it did for me. And excuse me, during the course of my research, I combed over probably 8,000 plus research journals, scientific studies, clinical studies, and was just really blown away by what I found. And we really became active in sharing oils with others at that point. But the thing that struck me that there was so little information about medication interactions out there. And, having done my research, I would come across a mention of it every now and then, but there was never anything in writing that was readily available to the public. So I decided this was, a much needed subject that needed to be addressed. And so I sat down and compiled all my research and put together essential oils and medication interactions. And it's currently available for download on our website, as well as Amazon.com and iTunes. We are in the works now with a publisher and printer to have it put out into a print edition. Hopefully, we're going to have that available by September at the big annual conference. Now, when I did the webinar this morning, I think I may have unintentionally scared a few people with the information in it. That is not my intent. The objective of this presentation is it's to help you guys. It's to promote and empower responsible wellness advocates. It's to give you another tool to use to help share oils with people and to do it safely. And, I want to inform and educate. And lastly, I want to be able to minimize your risk when sharing oils with people. Now, we've all used essential oils, and we know that they're extracted by distillation from various parts of the plants, be it the seeds, stem, fruit, leaves, bark, and so forth. Each of these oils will contain hundreds of unique compounds, and each of these compounds can have various physiological and emotional effects on the body. With the hundreds of compounds, you may have more than one effect. So, it's really fascinating and intriguing to me with the oils. And the main difference between essential oils and Western medication has been I would probably say 90+% of all Western medication is derived initially from plants. The biochemists go in and they isolate an individual compound that has the effect that they're going for. They take that compound and then they attempt to synthesize it. Doing this, it makes it a stable function. It will have the exact same effects every single time. And but as a result of being a synthetic and with the additives in it to stabilize it, you get side effects from that. That's why Tylenol treats, aches and pains and fever, but has 500 side effects. An essential oil will treat numerous ailments and have relatively few side effects because it is natural. Again, I mentioned that Western medicine has predictable and reproducible effects. With the oils, it's going to vary because you're not dealing with one compound, you're dealing with hundreds of compounds. And those results will also vary depending on the batch of oil. Depends on the growing season that they had that year. Was it, too little, too much rain, the temperature, humidity, was there, disease affecting that crop? All those things have have impact on the oil quality and as well as the compounds. And essential oils are evolving. This is key right here. You've heard that, you may or may not have heard that CDC has put out that we have reached the end of the antibiotic era. There are no more antibiotics to be made. We've hit the end. And bacteria are becoming resistant. They're adapting, they're growing, they're getting stronger. The antibiotic, we just use Levaquin, for example, that was used 5 years ago is the exact same one that's used today. The bacteria are very different today than they were 5 years ago because they are living, they're constantly evolving and adapting. Uh, Essential oils, as we know or may not know, that a lot of the essential oils are able to treat or to kill drug-resistant bacteria. And this is because they're evolving and growing as well. So the batch of oil that you got 5 years ago will be vastly different from the oil that you get today. So that's a huge plus, and that's going to show a lot of promise in the future in dealing with the drug-resistant organisms. Now we're talking about interactions. Drug interaction is essentially it's a situation in which a substance, usually another drug, affects the activity of a drug when mixed together. These interactions can be what are called synergistic effects, working with the oil or working with the drug to intensify the effect of that drug. You'll see this with like lavender using, with a sedative agent such as like Xanax or Ativan. Using Xanax and lavender together will intensify the effect of that Xanax. You can have antagonistic effects. An antagonistic effect is something that counteracts the desired effect of the drug. You can have altered drug levels due to an essential oil that alters the way that the liver metabolizes certain medications. This is a big issue with certain drugs like lithium, that you'll see that a lot frequently in this presentation. Lithium is one of those drugs that have to have a range, a certain level in your body for it to be beneficial. Little, you won't have the desired effect. Too much, you can have lithium toxicity. And I wanted to point out too that this presentation in the guidebook essential oils and drug interactions is not doTERRA specific. This goes for all essential oils. And one of the problems that I came into when researching the book was that there's relatively limited research available. Numerous reasons for this is it's, as of now, it's not widely known by the medical community. It is becoming, the medical Western medicine is gradually, we're seeing a trend where they're looking for more alternative medications. But as a whole, you will find a lot of healthcare providers are, I wouldn't say ignorant to essential oils, just not educated on it. It's not, commonly, we're not taught this in school and college. Another reason is big pharmacy. Big pharmacy they have no financial gain in research essential oils. That's because essential oils are natural products. You cannot patent, an oil. And therefore, because they're not going to make any profit, they have no incentive to invest millions of dollars in research. Kind of getting on my soapbox with big pharmacy. Big pharmacy governs all of Western healthcare. Big pharmacy dictates the protocols and procedures that we in healthcare follow on a day-to-day basis. The American Heart Association dictates the way that we do CPR. They dictate the way that we do advanced cardiac life support when somebody is having a heart attack. And what's interesting about that is on the board of directors and advisors, 9 out of 10 of those advisors are all executives of pharmaceutical companies. So no surprise that when the new ACLS protocols come out that one of their medications is not at the top of that list of first line drugs that we give. Now, drug interactions are very costly to the healthcare system, which is, in turn passed on to the consumer, to the patients. One Canadian study between 2006 and 2011 estimated the cost of drug interactions at around $35 million. In this study, at least 1 in 200 senior citizens were affected, and 1 in 1,000 non-seniors were affected. And these interactions ranged from, just an in and out ER visit to up to lengthy hospitalizations. Now, what I want you guys to be aware of is when you're sharing the oils is that there are certain classes of medications that need to set off red flags to you. These are not absolutes that you cannot use an oil with somebody, but these are classes of medications that you need to say, hey, you might want to check with your doctor before using this, because there, can be some potential issues with these. The first class is one of the more dangerous ones are your anticoagulants. These are your blood thinners. You'll see these more commonly in your geriatric population. They're taking these blood thinners to help reduce their chances of clotting, and these are patients that have mechanical heart valve, prosthetic heart valves. They're prone to clotting disorders like blood clots in their legs or in their lungs. People that have pacemakers, those type of things. So, and a lot of people are placed routinely on aspirin as a precautionary for heart disease. This is done to help prevent blood clots and cause heart attacks. So, very common to see people on aspirin or medications like Plavix, heparin, Coumadin. Next class are the anti-neoplastics, very fancy word for cancer drugs. So, just be alert in your cancer population that they're probably going to be on a lot of medications, and that these are ones that they're going to want to work with their doctor on before they start taking some oils. Opioids are your pain medicines. That's your next class over here in the yellow. There's a lot of the oils that have the sedative effects, and these are going to intensify the effects of the narcotics. And you don't want to, somebody that's taking, Vicodin for pain, and they shouldn't be driving anyway with it, but people do it all the time. But say they're driving with their Vicodin and they just put lavender on their neck. Well, it may intensify enough that it makes them too drowsy to drive and they have an accident. So that's something that you want to try and avoid. Next class are what is called glucocorticoids. It's another fancy name for steroids. You'll see a lot of steroids with your asthmatics, your chronic bronchitis, what we call COPD patient, chronic obstructive pulmonary disease. Those tend to have a lot of reactions as well. Next class, it's not really high on the percentage risk of reactions, but it's a class called NSAIDs, or non-steroidal anti-inflammatory drugs. These are your arthritis medicines that you take for chronic inflammation. This is your Aleve, your ibuprofen, Voltaren, things like that. The main interaction that you have with those are the oils that cause that are high in methylates, like your birch and your wintergreen, and those can also prolong bleeding times. And with non-steroidals, it's a very nasty class of drug, in my opinion. Their biggest issue with all non-steroidals across the board is that they are terrible on your stomach lining. They cause ulcers. Taking too much, it erodes your stomach lining and can put you at a high risk to develop a GI bleed. And it's a very nasty thing to have. And the other issue with the nonsteroidals is they're very hard on your kidneys. I've seen these put countless people into kidney failure. And your last class that you need to be aware of are your beta blockers. These are going to be your heart medications and a lot of blood pressure medicines. So, a lot of these are not, just because you see somebody that are on blood thinners, that doesn't mean, no, you can't take oils. What I'm trying to stress here is that be aware of it, refer them to their physician to make sure, okay. Because last thing we want to do is to cause further harm to somebody. I've kind of categorized this into high risk and moderate risk oils for this presentation. Now, I've listed a lot of medicines on here that are classes of medications that are going to interact. This is not inclusive of all medications, okay? Don't mistake me here. It'd be way too time consuming to go through all this to list every interaction. So far, I have found over 700 drug interactions. So, birch is one of the ones that it's high in methyl salicylate. These are going to cause potential bleeding problems for those taking anticoagulants, and it's one that you want to avoid for people that have seizure disorders. Birch can actually put somebody with a seizure disorder at a higher risk to have a seizure. Cassia is one that you want to avoid in liver disease. There's studies that have come out now that have shown that excess of cassia is causing liver damage. Now, what is excess of liver or excess of cassia? That I'm not sure. I know that the European Union has put restrictions on the amount of dietary cassia that people can use in restaurants and that sort of stuff. Now, what's interesting, most of the cassia sold in the U.S. is actually sold as cinnamon. So one thing you might want to be aware is when you go to buy your next box of cinnamon is to make sure that it's actually cinnamon bark and not cassia. Ginger, it's one of my favorite oils, very beneficial, but there is a significant risk with a medication called nifedipine. It's an older medication that used to be used all the time for blood pressure, not so much anymore. But the interaction puts them at very high risk to develop GI bleed. Kind of ironic because ginger is one of those great oils to help decrease and even heal up gastric ulcers. And that's one that I recommend to people that when they're on stools to help protect their stomach lining. Grapefruit, another one of my favorite oils, but unfortunately it does not play well with a lot of medications, and it is a extensive list of medications. So grapefruit should always be a red flag that, before I recommend this oil to you, I want you to check with your doctor to make sure this is going to. Although it does not have any medication interactions that are known, it is one to avoid with gallbladder disease. And the reason being, helichrysum stimulates bile production. If you've got somebody that's got a bad gallbladder that's full of stones, you actually send them into a gallbladder attack. So definitely want to avoid that with a bad gallbladder. Wild orange, put that up there with ginger, is one of those red flags to use caution with. A lot of interactions, and a lot of the interactions that you'll see with the citrus oils, like your grapefruit, lemon, wild orange, and so forth, is that they are photosensitizing, and so they put you at higher risk for sunburn and skin damage as well. So you add those two together and you're setting up for really nasty sunburn. Wintergreen, that is one that is high in methyl salicylate that you want to be used caution with the blood thinners or your anticoagulants. Now, for your moderate score, these ones that there's it's just a possible possible risk for interaction. That doesn't mean that everybody that takes it is going to have a reaction or interaction. It just means that there's a moderate risk that interaction will occur. So I always advise people, that I'm sharing oils with that probably but you aware and keep an eye out for side effects. And if anything, arises that's not normal, you may want to stop using that particular oil. Bergamot, that's one of those potential if taken high doses. And more than likely, it was a child that had gotten into a bottle of oil and down the entire bottle. Too much of anything is going to be dangerous to you. So, we treat the oils just like any other medication, keep them out of reach of children, and out of sight, out of mind. Black pepper, this is one that can affect the way meds are broken down by the liver. Certain medications that, like I mentioned, lithium, that you have to have a specific range, therapeutic level in your body. Those are types that are going to be affected by this. Cedarwood is one of those. It is a very potent sedative. So mixing those with, Ativan, being alcohol, those kind of things can be possibly problematic. Clary sage is interesting that if taken in large amounts can actually cause intoxication, and it's going to potentiate those sedatives and alcohol as well. Clove is one that I've seen several studies that they do not recommend internal use or for children under 6 years old. There's been some reports of children that have had seizures, coma, death associated with that. But what those studies didn't mention was exactly how much clove did they get. Would I use it on my kids for teething issues? Yes, I will dilute it first, and just a responsible use of it. 1 drop diluted in coconut oil every few hours. I don't see any issue with that. But I just, a lot of this put it out there to make people aware that there is a potential problem. So that's why it's included. Dill is one that does not play well with lithium. It can alter the lithium levels and make those levels hard to regulate. Eucalyptus is another one that affects the way meds are broken down by the liver. Fennel, interesting that I found that can lessen the effectiveness of birth control pills. So use caution with that when giving it to those women in childbearing years. They probably don't want any unexpected surprises. And avoid use of hormone-sensitive conditions, breast cancer, uterine cancer, fibroids, things like that. Fennel has a very strong hormonal effect and can actually worsen or speed up breast uterine cancer. Ginger is one of those. Again, it does have some methyl salicylate in it, so it's going to interact with the anticoagulants and put them at higher risk for bleeding. Is this one that I would tell people not to use? No, but I would tell them to be aware for any unexplained bleeding. and keep a close check on their levels. Juniper berry, yeah, I had mentioned earlier about uh, synergistic effects. This is one with that's going to have a synergistic effect with diabetes or diabetic medications. Juniper berry lowers your blood sugar. So taking that along with your diabetic medicine to lower blood sugar may uh, you can look at it 2 ways. It may lower the blood pressure or blood sugar too much, or it may function. So this one can actually, somebody with diabetes, it takes is, you guys hear me? How about now? Still breaking up? Okay, let me go back over and I'll start from the top again. Um, Moderate risk of oils. Fennel is has been found that it can interact and decrease the effectiveness of contraceptive oral birth control pills. So be careful using that with people that are on birth controls. You don't want to give them any surprises. And avoid use with hormone sensitive conditions such as breast cancer, fibroids, or uterine cancer. There have been numerous studies that show that fennel use can actually speed up breast cancer and accelerate the growth of breast cancer cells. Definitely want to avoid that with breast cancer and uterine or ovarian cancer. Ginger is high in methyl salicylates, so avoid that with the blood thinners. Juniper berry is one that is going to have a synergistic effect with diabetic medications, meaning that it can intensify the effect of those medications. You can look at that as a positive or a negative. The positive effect that you can use juniper to help lessen the amount of medications they need. But diabetic patients, a lot of them have a very hard time regulating their blood sugar. It can get too high or too low. They get too low, then it may get too low to the point that they're not able to maintain consciousness and slip into a diabetic coma. So just, if you're suggesting, oils to a diabetic patient and, just tell them that, you're going to have to check your blood sugar more frequently than you normally do until you find out how this is going to affect you. So, if they're compliant with it and they stay on top of it, juniper would be a great way to help lessen the amount of medication that they need. If it's somebody who, only checks their blood sugar once every week or so, I would not recommend that to them. It's all going to depend on the individual. Lavender is one that's going to potentiate, have a synergy effect with sedatives. It's going to increase the effect of that medication. Lemon is one that, like I said, with the citrus oils, lemon and lime, that's going to have the photosensitizing effect with certain medications. So watch out when they're in the sun. Marjoram is one that doesn't play well with lithium. It's going to affect the lithium levels. Melissa also has a sedative effect, so be careful with the sedatives, and it also a lot of thyroid medications it's going to interact with. So and those, it may affect it, how effective that thyroid medication is. Myrrh, you're going to watch out with diabetes. Again, that helps lower blood sugar, so um, it's a judgment call. Oregano doesn't play well with lithium. And peppermint is going to also, with the way certain medications are broken down with the liver, it does have the methyl salicylates in it, so it's going to possibly interact with anticoagulants or your blood thinners. Roman chamomile, another one that might give you a surprise if you're on birth control pills. Sedatives, anticoagulants or your blood thinners, your non-steroidals, that's your arthritis medicines. And Roman chamomile has a huge list of drug interactions. It's like grapefruit, so that's one that you need to be careful with. Rose oil is one that's going to affect the birth control pills too, and also certain non-steroidals, your arthritis medicines, and blood thinners. Rosemary, want to use caution with that with people with high blood pressure and seizure disorders. Rosemary actually will raise your blood pressure and also put them at a higher risk to develop a seizure if they do have an underlying seizure disorders. Sandalwood, both regular and Hawaiian, don't play well with lithium. Thyme is one of those that's going to, high in methyl salicylate, so watch out for your blood thinners and your non-steroidals. Lang-lang, have to be careful with antihypertensives, your blood pressure medicines. It can actually raise your blood pressure. And somebody on the webinar this morning, somebody had mentioned that, they use Lang-lang to help. I don't doubt that at all. There's, like I said, each oil has hundreds of compounds and they're going to have different effects in it. So, and with high blood pressure too, there's so many factors that get into that. So, whereas Lang-lang might, if I took it, it might shoot my blood pressure through the roof. Another person beside me may take it, it may lower their blood pressure. It's just, there are no absolutes with this. So, it's just, I'd say tell them to try it, but just keep a close check on their blood pressure. Now, there's a lot of oils that you want to avoid during pregnancy. All of these listed here, your cedar wood, dill, juniper, lemongrass, marjoram, myrrh, Roman chamomile, rose, sandalwood, thyme, and vetiver, all have hormonal effects. And these effects during pregnancy can actually stimulate uterine or vaginal bleeding, or stimulate the body into thinking it needs to have its menstrual cycle, and may potentially cause an spontaneous abortion. So always make sure they're not pregnant when using these oils. Rose oil in ancient times was actually used, given to people to, for an abortive to get rid of unwanted pregnancies. Hopefully I haven't scared you off by this, presentation. Like I said, from the beginning, the intent was not to scare you, to turn you away from walls. It's just to bring in an awareness that you need to take this seriously, that things that you need to do, or to review their medications with them. You don't have to be a doctor or a nurse, or pharmacist to do this. It's just helping them help themselves. We all got into this as, we wanted to help ourselves, to help our family, and to help others. And if we give them an oil and they have some horrible reaction with their medication, chances are they're not going to want to use that oil again. or any oils for that matter, and they're definitely not going to help you promote these oils. So, you're helping them by reviewing their medication. And, if there's any question you don't know, just refer them back to their physician. Uh, that takes the burden off of you. And also, well, hopefully set them on the right path. And like I said, use extreme caution using oils with blood thinners and cancer drugs. And don't forget your disclaimer. We at doTERRA do not diagnose, treat, prevent, or cure disease. Hopefully after that presentation, you understand the importance of that disclaimer now, more so than before. And like I just mentioned, if the person you share with has a bad experience, they're going to be less likely to use or promote the use of these oils. Some additional resources for you if you want to get some more information. You can go to our website, maddoilers.com. There's a tab under there called Nurse Call. That is where people can anonymously submit questions, medication or medically related. I'll review those questions, research them, and get the best answer I can for you. You don't have to list your name in the question. I keep that private. So if there's any sensitive medical questions or embarrassing medical questions, you don't have to put that out to the world. But I'll do this anonymously. And like I said in my book, Matt Oiler's Guide to Essential Oils and Drug Interactions is available for download for on Amazon for Kindle, as well as iTunes. I am in the works of getting it available for Android devices, so that you can have a little quick pocket reference as well. And again, I'm working on having a print edition out so that for those of us who like actual books rather than a e-reader or Kindle can have it in their hand. Where I get a lot of my information is PubMed.gov. This is the National Institute of Health website. There are thousands and thousands of research articles, scientific studies that you can go to it's a valuable resource. A lot of medication interactions are listed in there as well. It can be a little dry and technical, but for the most part, you can pick out the information that you need. Another good site is the NCAM, NIH.gov, and that is that's like a subsection of PubMed. And what that is it's the National Complementary and Alternative Medication section. So you find a lot of really cool studies there as far as alternative medications and treatments and therapies that you wouldn't ordinarily find. And somebody had asked me earlier in the day about the Aromatic Science site. That is a great site as well. Some of the questions posed from this morning that came up that I thought were really good, I thought I would just go back over those with you. Somebody had asked about, allergies to oils versus sensitivity. Yes, it's true that most of the allergen proteins have been distilled out of the oil so that people aren't going to have allergies. Is it still possible for them to have an allergic reaction? Yes. But in my case, my children have numerous food allergies. My son, for example, is allergic to all citrus fruits, tree nuts, and his favorite oil is wild orange. He keeps several bottles in his bedroom and uses it daily. So that is, he's had no issues with the oil, with any of the oils, and as far as allergies. The biggest issue that people run into are getting sensitized to the oil, and that is from people not properly diluting the oil with a good carrier oil. And what what that happens is, somebody uses their favorite oil, and they're using it neat, not diluting it. They're rubbing it directly into the skin, and they've been using it for some time now. Well, one day they wake up and they've got this horrific rash where they've been applying the oil. That's sensitization, and unfortunately, that is for life. So chances are that if they become sensitized to that particular oil, they will never be able to use that again. So please always dilute and use your carrier oils. Next question was grapefruit interactions. Somebody said that they were told that because it comes from the peel and not the fruit, that they're not going to have any reactions. Unfortunately, that is not true. The information I put into my book are from documented medication interactions with essential oils. So there's the oils that I have listed under the grapefruit in the book those are the ones that are, like I said, are documented. Now, if you look at medications that interact with grapefruit, there's probably hundreds more. These are the ones that are specifically documented as reactions to grapefruit oil. Another question is that people said that they had noticed that there was some information that was contradictory to what was written in I think the ME book. Yes, that's true. You're going to find I found numerous contradictions in there. That is because, the ME book is well written. I use it on a daily basis. And, it's like any scientific study. People are going to find a fault with it. I'll use the lavender study with breast enlargement in boys. If you're familiar with that, a couple of prepubescent boys had gone to the doctor with breast enlargement, and they looked into it, and somebody did a study with different hair products or hair and body products that had lavender in there. So they attributed the lavender to causing the breast enlargement. However, when somebody actually sat down and looked at the study, they found numerous flaws in it. There were other chemicals associated in there as well that were not addressed in that. All they did was focus on the lavender. So there were a lot of variables that were in there that were not addressed. So any scientific study can be, torn apart. What I did in my attempt was that if there was a medication interaction listed, I'm kind of erring on the side of caution and listing it as a potential reaction. Will it happen if you take that? Not sure, but I use the best information available at hand, and hopefully it's accurate. But you will find some contradictory information out there. So it's just like if you go to 10 different doctors with a condition, you're probably going to get 10 different opinions on it. You just have to go with the best information at hand and the information that you feel most comfortable with. And also wanted to point out that not all drug interactions were discussed in this presentation. Like I said earlier, there's over 700 drug interactions. We would be here all night going over those. All right, let's see. Looks like Dila is asking a question. When sharing essential oils, do you recommend keeping Benadryl on hand? No, not at all. When I share oils with people, I do my typical nurse thing. Are you allergic to anything? Are you on any medications? And, after reviewing that, I, say, well, there's a very minimal risk of an allergic reaction. If it's I also trying to determine the extent of their allergies. Is it, Do you just get a itchy, watery eyes, or do you have to use your EpiPen when exposed to it? So, I don't run around with an emergency kit, but every time I run out, and share oils, I just I kind of caution people. I said, slim chance that you might have a allergic reaction to this. Just if you're concerned, keep some Benadryl handy, that sort of thing. And let's see, Melissa is asking, so you personally use oils with a carrier, same with your children? Yes, you always use carrier oils, um, and especially your kids. Cameron Cameron was dealing with a lot of eczema issues for a while, and he's the one with the numerous food allergies. And so his daily ritual was using Melaleuca and lavender with raw coconut oil. And Melissa again asked if my preferred carrier oil is coconut. Um, let's see. Khalid is asking, where can the study be found for oral contraceptives? That was found in PubMed. I can't tell you specifically off the top of my head where it is. If you shoot me an email later, I'll try and find out that specific study for you. Any other questions? Let's see, Lisa's asking a good question here. You recommend referring back to their doctors, but what if they don't know anything regarding essential oils? Um, you can't make the person choose their doctor. I would, advise somebody that, is knowledgeable about that subject. You're more than welcome to shoot me emails as far as, medical and oil questions, medication wise. Uh, it's one of my favorite things to do is to research this and find out. So, hopefully their physician is knowledgeable on oils, but like I said, because a lot of them are not trained and educated on it, they may not know. Uh, and this is also just from kind of a liability standpoint, is that you refer them back to the doctor, and that kind of puts the burden on them rather than you. I don't know of anyone that has ever been taken to court over essential oils other than the doTERRA Young Living issue, but I'd hate to see that happen to somebody. There is a possibility of it, although I think it's minimal at best. But anyway, Lisa is asking, where are you? I said, I am in Anchorage, Alaska. Let's see. Tony says, my husband has bad inflamed knees. They may be giving him pain shots. Any oils I should avoid? I would have to know specifically what they're giving him. Typically, if they're giving him injections in the knees, those are going to be steroid based. So I don't know that if, unless he's not, I'm assuming he's not on any other medications. If it's a local steroid injection, I don't think I would avoid using any oils. Go with your pain oils. Your birch, your wintergreen, your deep blue, your thyme, oregano, things like that. Lisa is again asking, said, my hometown is Mississippi, I assume. Where can I get more info regarding sensitivity? Numerous books out there regarding, oil safety and sensitivity. The ME book is a good one. So I would refer to that. A lot of good information out there on, what is it? Essential Oil ME, I believe. Don't hold me to that. I'm talking off the top of my head over here. Let's see. Next question. What about drinking oils in water? Do you use an emulsifier in the water? I do not personally. You know, mixing, I add lemon to my water every day or lime, and I just add the ice to it, add a drop of lemon or lime in there, and then fill it up with water and down it. So keep it simple that way. And yes, I have recorded this presentation, and I will have it posted to the website probably later tonight or tomorrow. I believe numerous people that were not able to attend have asked for this to be emailed, so we will look into doing that as well. And oh yes, you're more than welcome to share this with your team members. This is why I put this book out there. We want to get this out there to as many people as we can. We share this information with them. And Tony wants to know how I can send you my question. If you go to our website, madoilers.com, and click on the Nurse Call tab, there's a form right there that you can send a question, and I will answer that as quickly as I can and get the information back to you. Another thing I do with that Nurse Call is I post all questions that are submitted to me on that page, obviously without the person's identification. And that is a great resource for a lot of people that have the same, they may have same questions or just, in general looking for knowledge on something. Let's see, Dilo was saying, I was introducing new people to essential oils today, and someone mentioned that I should introduce the EO on a fragrance stick or tab. What do you think for decreasing sensitivity? Would this help? Again, if you add a little carrier oil to it to dilute it, I don't think you'll have any problem with the sensitivity. But again, that depends on the person. As we all know, some people are a lot more sensitive than others. Just like with a mosquito bite. Whereas I won't swell up. My wife, she'll get this huge, ugly hive from one mosquito bite. So it's, just, it all depends on the person. Lisa is asking, has doTERRA or Young Living responded to my research? Not to my knowledge. If they have, I'm not aware of it. All right, well, I'd like to thank everybody for joining in. This has been a great presentation for me. I hope you guys were able to learn something tonight, and we had a great response from the webinars today, so it looks like I'll definitely be putting these on again in the future. Feel free to check back with us, see when we're going to post it again, and if not, it will be on our website shortly. And you guys have a great night.